A brain doctor warns that one common fruit might quietly increase your stroke risk overnight. It's more serious than most people realize, but simple changes can protect your health. Stay until the end. The last tip is the most surprising and crucial. Let's begin with a common favorite, one often hailed for its health benefits, the banana. As a brain doctor, I've witnessed countless sudden strokes, but few things disturb me more than seeing seemingly harmless behaviors stealthily cause calamity. Believe it or not, bananas can pose a hidden risk, something you've probably heard praised your entire life. Bananas are widely regarded as great snacks, soft, easily digestible, and rich in potassium, making them appear heart healthy. This might be perfectly true for most 30 and 40-year-olds. However, after the age of 60, your kidneys, blood arteries, and heart react quite differently to fluctuations in potassium levels. Let me clarify. As we age, our kidneys naturally slow down, becoming less efficient at filtering, especially if you also contend with high blood pressure, diabetes, or take medications like ACE inhibitors, diuretics, or water pills. This means that the potassium, which bananas are notoriously high in, can accumulate in your blood. And then what? Your heart might begin to misfire, blood vessels can tighten, and most critically, blood clots can form in places where blood should be flowing freely. A clot in your brain can shut down everything in mere seconds. I'll forever remember Raymond, a 66-year-old retired carpenter from Ohio, one of my patients. He was active, sharp, and prided himself on eating well. Every morning, he sliced bananas into his oats and took his blood pressure medication with orange juice, a regimen he followed diligently for over a year. But one morning, his wife found him collapsed in the bathroom, his left side immobile and his speech slurred. At the hospital, scans revealed a small but devastating stroke. His excessively high potassium levels, coupled with his prescription medication and 2 bananas a day, had disrupted his heart rhythm and led to nocturnal clots. He had no idea of the danger. This is what most seniors don't realize. You don't need that much potassium, whether from supplements, food, or consumed all at once. Just one large banana contains about 450 milligrams of potassium. If your kidneys aren't functioning optimally, this amount can easily upset your body's delicate balance. Consuming that banana at night, when your circulation naturally slows, your hydration drops, and your medication is actively circulating, can create a perfect storm of stiff arteries, sticky blood, and a clot that may never clear. So what should you do? If you're over 60 and take heart or blood pressure medications, limit yourself to half a banana per day, consumed in the morning, and pair it with protein like Greek yogurt or nuts to slow its absorption. Crucially, avoid banana smoothies, banana bread, and especially eating them before bed. Most importantly, always discuss how potassium-rich foods might affect your medications with your doctor, because your life truly may depend on it. The truth is stark. Without the full picture, what was once beneficial for your body might no longer be safe. If the information about bananas has stunned you, wait until you hear what those seemingly innocent, sweet little grapes are doing to your blood sugar, your brain arteries, and your silent inflammatory risk. What I'm about to reveal might forever change your snacking habits. If you're still watching and finding these insights helpful, please leave a comment. Next, let's turn our attention to grapes. Juicy, sweet, and undeniably refreshing, a nibble of grapes seems as innocent as a gentle spring breeze, whether on a fruit platter in your cereal bowl or after Sunday lunch with the grandkids. However, grapes can silently trigger stroke risk in people over 60, particularly those with underlying vascular abnormalities or unstable blood sugar. Their thin skin cleverly conceals an abundance of sugar, which is surprisingly easy to overlook. While each individual grape might not seem dangerous, an entire bunch, especially the popular seedless, extra sweet varieties found in most supermarkets, can pump a rapid surge of natural glucose and fructose into your circulation. This sudden sugar surge comes at a significant cost for aging brains and blood vessels. As we age, our bodies manage blood sugar less efficiently, our insulin response slows, and our blood vessels naturally weaken. Spikes in sugar levels don't just stress your pancreas, they also inflame the sensitive walls of your arteries, particularly those supplying the brain. Inflamed arteries can harden and narrow, and over time, the artery lining might even tear microscopically, leading to blood clot formation. You may not feel this happening, and routine checkups might not immediately detect it, but your body is quietly preparing for a silent stroke. Consider Mrs. Jeanette Morris, an 80-year-old retired teacher from Missouri. She championed natural living, always consuming fresh fruits, avoiding soda and processed foods. Her favorite mid-morning snack was a generous bowl of red grapes, which she sometimes ate nearly 2 cups of while reading the paper or watching the news without a second thought. One day, while writing a birthday card, her vision blurred, and her hand began to shake as she forgot how to spell congratulations. Fearing a stroke, her daughter rushed her to the hospital. A clot had temporarily interrupted blood flow to her left brain, causing a transient ischemic episode or mini-stroke. Mrs. Morris was shocked when her A1C, a long-term blood sugar test, had moved into the pre-diabetic range, and her lab tests indicated significant noon sugar spikes. Even more concerning was the evidence of chronic, low-grade inflammation in her vascular system, likely a consequence of years of a high-sugar fruit diet without adequate protein or fiber. I want you to grasp this critical point. Without the right context, even supposedly nutritious foods can become hazardous. For those over 60, the timing and accompaniment of your food are as vital as the food itself. Grapes digest rapidly, delivering a quick shot of sugar to your bloodstream. If you consume them alone, especially when thirsty or under stress, your blood can thicken, your arteries constrict, and your clotting risk increases. Though you won't notice it today, this process builds night after night, week after week, until something eventually breaks. I now advise my senior patients to avoid grapes on an empty stomach and in large bowl-sized servings. Instead, pair a handful with protein, nuts, or cheese, and restrict quantities to a modest handful during active hours when your body is better equipped to burn off the sugar. If you are diabetic or on blood pressure medication, it's often best to skip them altogether unless specifically recommended otherwise by your doctor, because a simple snack can slowly, imperceptibly deprive you of your balance, your memory, and your independence. Moving on to another popular tropical delight, one that many seniors enjoy, but which can unexpectedly spike blood sugar and cause harm due to its acid, enzymes, and particular impact on the brain during the evening hours. Let's talk about pineapple and why your favorite post-dinner dessert might actually be silently damaging your brain while you sleep. Pineapple tastes like pure sunlight in a bite, sweet, tangy, and refreshingly tropical. Due to its light, natural profile and perceived digestive enzymes, many of my senior patients appreciate it as a guilt-free pleasure after dinner. However, what most seniors don't realize, and what deeply concerns me as a neurologist, is how this fruit, when consumed at the wrong time or under specific circumstances, can silently increase stroke risk, especially overnight. Pineapple contains bromelain, a protein-digesting enzyme. While small quantities of bromelain might aid digestion, excessive consumption, particularly in conjunction with certain medications, could potentially impair blood coagulation, platelet function, and affect bleeding or clot formation. This imbalance can be particularly dangerous for someone over 60, with naturally thinner blood vessels and a slower metabolism. And let's not forget the sugar. 1 cup of pineapple has nearly 16 grams of natural sugar, which rapidly elevates blood glucose. Pineapples also possess a high glycemic index, meaning they spike blood sugar faster than many berries or apples. Late in the day, that rapid increase doesn't provide useful energy. Instead, it circulates, straining your blood vessels while you sleep. The most overlooked threat, however, is its acidity. Pineapple is among the most acidic fruits in America. It can irritate the esophagus and trigger silent reflux in some elderly individuals without obvious burning sensations. This microaspiration and variations in overnight airway pressure can restrict oxygen delivery to the brain during sleep, dramatically raising the risk of early morning strokes, the most lethal type. I treated Mrs. Clara Hughes, a 77-year-old retired choir director from North Carolina. She was sharp, energetic, and meticulous about eating clean. Instead of manufactured treats, she consistently had fresh pineapple slices after supper, a nightly routine she followed for over a year. One morning, she awoke groggy and disoriented. Her daughter observed her slurring her words and unsteadily walking. A CT scan revealed a minor posterior circulation stroke, which affected her balance and speech. Her blood tests showed high overnight glucose levels, nocturnal reflux discomfort, and subtle platelet abnormalities. The culprit, her nightly pineapple habit, the combination of acid reflux, sugar spikes, and bromeline's effect on blood clotting created a perfect storm. She thought the fruit was helping, but it very nearly took her independence. Clara's story is not unique. Seniors have slower digestion, thinner vessel walls, and more fragmented sleep. If you consume acidic, high-sugar fruit at night, your blood vessels can constrict during rest, precisely when the brain is most vulnerable, silently building blood clots that can cause a stroke as you sleep. What's the critical lesson here? Pineapple is best consumed early in the day and in modest portions, never on an empty stomach. Avoid mixing it with blood-thinning medications unless expressly advised by your doctor. Most importantly, strictly avoid eating it before bed. Your brain requires stability, not surprises, while sleeping, because at this age, even fruit can tip the scales toward danger. If pineapple surprised you, brace yourself for the truth about watermelon, a fruit famous for its hydration, but one that may also discreetly dehydrate your brain and dramatically reduce your blood pressure, potentially leaving you vulnerable to collapse. Let's discuss how water can paradoxically be deadly. Please let me know you're watching by commenting number 1 below if these insights are proving helpful. Next, we delve into watermelon, a beloved symbol of summer across America. Cool slices on July 4th, seed-spitting contests with grandkids, and that sweet, refreshing crunch after a hot afternoon spent gardening. It feels inherently safe, undeniably good, and certainly brimming with water. Yet, watermelon can quietly harm the elderly, particularly those with pre-existing cardiovascular issues or on certain medications, by inadvertently stripping essential nutrients and fluids from the body. As a brain doctor, I'm concerned by how often older individuals unknowingly heighten their stroke risk through seemingly acceptable foods, and watermelon epitomizes one of the biggest myths. Watermelon is a natural diuretic, meaning it increases urination. While this poses no issue for a 25-year-old, frequent urination can lead to nocturnal dehydration, one of the most hazardous silent stroke triggers for a 75-year-old with sensitive circulation, borderline blood pressure, or those who use water pills or ACE inhibitors. Why? Because dehydration thickens your blood. Imagine thick syrup slowly pouring through tiny tubes. Thick blood travels sluggishly, giving it more time to develop clots, especially within arteries already narrowed by age. Slow or interrupted blood flow makes the brain significantly more sensitive to oxygen fluctuations, a particular risk at night when blood pressure and circulation naturally plummet. Consider Howard Larkin, an 82-year-old retired postal worker from Indiana. He walked daily, shunned processed sugar, and opted for nutritious snacks, doing everything he believed was right. He especially enjoyed eating 2 or 3 large slices of watermelon after dinner to cool off and stay hydrated. What he didn't realize was that he was also taking a diuretic for mild heart failure. Between the medication and watermelon's natural water-pulling action, Howard lost too much fluid overnight. One morning he experienced severe vertigo, and attempting to stand, he fell. At the hospital, he was diagnosed with dangerously low blood pressure and highly concentrated hemoglobin, a clear indicator of dehydration. He had suffered a minor ischemic stroke due to a clot that formed in his constricted arteries while he slept. Scans confirmed that instead of hydrating him, his beloved watermelon had quietly dried him out. Worse, the stroke severely damaged Howard's balance and coordination. He survived, but now relies on a cane and requires assistance with daily tasks, whereas just a week prior he had been mowing his own lawn. I share this story not to terrify you, but because most seniors are unaware that age, medication, and timing can render even truly nutritious foods harmful. Watermelon consumed late in the day, especially after medications that already reduce fluid content, can create a scenario of thick blood, low pressure, and sluggish circulation, allowing clots to quietly grow and strike overnight. Enjoy watermelon wisely. best consumed earlier in the day and ideally paired with electrolytes like a pinch of salt or a splash of coconut water. If you take diuretics, always consult your doctor before making it an everyday habit. Most importantly, listen to your body. Morning dizziness, a dry mouth, or sudden confusion are not normal. They are subtle warnings whispering for your attention, because even a fruit that's 90% water can silently steal your brain health. The worst part? Nothing might hit you until it's already too late. If this revelation startled you, wait until we discuss the everyday American orange, practically the face of a healthy breakfast. But beneath that vivid color lies a natural compound that could be dangerously interfering with your heart and brain medications, setting the stage for something far more harmful than most people realize. Next, we examine citrus interactions. Oranges have traditionally symbolized health in American households. Breakfast orange juice, a bowl of orange slices on the kitchen table, or even the classic Christmas stocking orange. For decades, they've been celebrated as nature's vitamin C wonder. However, oranges can silently trigger dangerous chain reactions in older individuals, especially those taking heart or blood pressure medications, leading to severe risks like blood clots and strokes. The issue isn't merely the sugar, though a large orange or glass of juice certainly raises blood glucose. The real concern lies in natural furanocoumarins found in citrus fruits, compounds most seniors have never even heard of. Furanocoumarins can critically affect the metabolism of statins, calcium channel blockers, and blood thinners. Instead of your body carefully and gradually processing your medication, it might hold on to too much, dangerously increasing its toxicity, or conversely, wash it out too rapidly, rendering it ineffective. This drug-fruit interaction can cause blood to become unstable, arteries to unexpectedly contract, or deadly clots to form without any immediate notice, slowly causing harm. As a brain specialist, I've witnessed too many patients suffer from what seemed like a simple, healthy mix of fruit and medication. Elmer Bryant, a 79-year-old retired bus driver from Georgia, was one such patient. Elmer, a kind man with a constant smile, took atorvastatin for cholesterol and amlodipine for blood pressure. He too valued a natural lifestyle, and his morning ritual began with a tall glass of freshly squeezed orange juice, his sunshine in a glass. What Elmer didn't know was that the furanocoumarins in the juice were inhibiting his liver from breaking down his medications. His blood pressure drugs were accumulating in his circulation, amplifying their effects, while statins built up in his muscles and bloodstream, increasing inflammation and potential blood vessel damage. After several days of feeling dizzy, Elmer suddenly stood up from his recliner one morning and collapsed. He was rushed to the ER, bewildered and with slurred speech. A CT scan revealed a minor ischemic stroke, and blood tests showed dangerously high drug levels, because the orange juice had prevented his liver from properly eliminating them. His blood had become unstable and circulated erratically. Yes, it ultimately clotted in a small artery in his brain. I was shocked, as were Elmer and his wife, when I explained this. "I always thought orange juice was healthy," he remarked, "and it once was, but the aging body processes pharmaceuticals differently. What worked at 40 may not work at 70 or 80. Grapefruit, many types of oranges, and even navel oranges should be consumed very sparingly by elderly persons taking medications. As people age, their livers slow down and drug-food interactions significantly increase. For people over 60, I strongly recommend consuming oranges with caution and never mixing them with prescription drugs without explicit medical advice. Choose lower-risk citrus like clementines, or simply squeeze a dash of juice into water instead of drinking full glasses. Most importantly, always ask your doctor if citrus is potentially conflicting with your medications, because it's not just your medicine cabinet that matters. Your fruit bowl holds immense power too. A daily, well-meaning habit can subconsciously nudge your brain towards disaster. While this might be worrying, knowledge is truly power. Simply modifying how and when you eat certain fruits could drastically reduce your risk. If you thought oranges were the only ordinary fruit with a dark side, stay tuned for the next one, a fruit routinely given out in hospitals and lauded for gut health and energy, but which might be subtly wearing down your nerves. Let's discuss apples and the hidden sugar trap no one warns you about. Apples are the epitome of American health, right? An apple a day keeps the doctor away. Crisp, juicy, and effortlessly consumed, apples are ubiquitous, given out in hospitals, included in senior lunch programs, and lovingly packed by grandkids who want you to stay well. Yet apples may not be as innocuous for older persons, especially those over 60 with blood pressure issues, diabetes, or cognitive impairments. The wrong apple, eaten in the wrong manner, can subtly increase your stroke risk by disrupting blood sugar and vascular stability. Not all apples are created equal. Many popular American apples such as Fuji, Honeycrisp, and Gala varieties are bred primarily for sweetness, not for balanced nutrition. These high glycemic load apples can flood your bloodstream with natural sugars faster than your aging system can manage. Eating them alone, particularly without protein or healthy fat to slow digestion, leads to a rapid blood sugar surge followed by a crash. This swift roller coaster effect impacts more than just your energy. It also profoundly affects your blood pressure, vascular inflammation, and blood viscosity. Spikes in blood sugar make your blood more acidic and sticky, while insulin levels rise and blood arteries constrict. This daily routine gradually damages the delicate lining of your arteries, particularly those in the brain. When microscopic tears form, blood clots appear to repair the damage. While this system recovers quickly in younger adulthood, for older persons with narrower, stiffer veins, such clots can silently build, eventually leading to a stroke. Consider Mrs. Louise Hammond, an 81-year-old patient from Pennsylvania who had always maintained good health through daily walks, consistent prescription medications, and a diligent diet. Her preferred snack was a huge Honeycrisp apple every single day, no chips, no cookies, just fruit. She wasn't aware, however, that she was insulin resistant, and her daily sugar surges were overpowering her aged blood vessels. She began feeling pressure in her head when standing, and her eyesight blurred in the evenings. One evening, while cooking, Louise had trouble speaking. Her daughter quickly took her to the ER, where an MRI revealed a mild stroke. Lab tests showed endothelial inflammation and unstable blood glucose levels. Her medications were working, but her apple-induced blood sugar spikes were quietly causing vascular damage, and a clot had developed, likely during one of those spikes. After recovering, Louise now views apples not just as healthy food, but as something to be carefully balanced. I advise my senior patients to choose apples judiciously. Granny Smith apples, for instance, have significantly less sugar and more brain-protecting polyphenols. To lower the glycemic impact, always pair apples with almond butter or cheese. Most importantly, avoid eating sweet apples on an empty stomach, especially at night. Your brain requires consistent sustenance, not a blood sugar roller coaster, because even a seemingly healthy apple can trigger stroke-causing problems. As your blood sugar fluctuates, your veins tighten and clots silently build until they become evident. If that surprised you, continue reading, because next up is a colorful, antioxidant-rich, superfood fruit that seniors often appreciate for heart health. However, beneath those ruby red skins lies a chemical that dramatically thins blood. For individuals on specific medications, that could mean a brain bleed or worse. Let's talk about cherries and why eating too many can be truly dangerous. If you're still watching and finding these insights helpful, please leave a comment. Cherries are tiny, vividly colored, and widely regarded as one of the healthiest fruits in the American diet. Doctors often prescribe them for arthritis, inflammation, and heart health. Senior wellness periodicals, organic food shops, and many recipes for yogurt and salads eagerly feature them. Yet, the appealing cherry flavor and its sparkling reputation conceal a hidden risk, particularly for older persons on blood thinners or anticoagulation medications. The danger lies in cherry salicylates, compounds that naturally thin blood much like aspirin. For seniors whose blood is already thinned by medications like warfarin, Plavix, or daily aspirin, adding extra salicylates from food can become perilously dangerous. The result, overly thinned blood, leaky vessels, and in severe cases, hemorrhagic stroke, brain bleeding. Most people would never associate such a grave outcome with a simple fruit, and it seems unlikely, yet I've personally witnessed it. Consider Daniel Rhodes, an 84-year-old retired railroad conductor from Illinois. After a small heart attack years earlier, he faithfully took low-dose aspirin daily, along with statins and blood pressure medications. He ended every dinner with a small dish of cherries, calling them nature's dessert, having heard they reduced inflammation and kept his great-grandkids entertained. The first several weeks were fine, but Daniel slowly started experiencing headaches, dizziness, and persistent nausea. One morning, he awoke disoriented and began vomiting. His wife immediately rushed him to the ER. A CT scan revealed a terrifying brain bleed, a hemorrhagic stroke caused by a ruptured brain vessel, a consequence of his overly thinned blood. The physicians initially ruled out medication errors. His dosages were correct and his vitals stable. However, a review of his diet exposed the truth. The cherry salicylates combined with his blood thinners had silently created a perfect, unsafe storm. The effects are often gradual and inconspicuous, making one feel fine right up until a critical point. Brain bleeds are incredibly difficult to stop, and recovery is often uncertain. Speech loss or loss of movement often occurs, and tragically, many never regain full independence. I desperately wish older adults knew this vital information. Even natural foods can interact dangerously with medications. At 70 or 80, your body processes substances differently than it did at 40. Someone on blood thinners might experience a life-threatening crisis from a fruit that helps younger people recover from minor discomfort. If you enjoy cherries, consume them mindfully. A few occasional ones might be safe, but avoid cherry concentrate, cherry juice, or substantial daily servings. If you are using anticoagulation medicine, always consult your doctor before incorporating cherries significantly into your diet. This lovely little fruit, especially in therapeutic doses, can become a significant problem in an older body already working hard to maintain its delicate balance. Thin blood doesn't just flow, it rushes, causing damage. If you believe the surprises are over, think again. Another fruit, widely touted for its antioxidants and presented in beautiful bowls at senior brunches, may unfortunately carry one of the grocery store's highest pesticide loads. These pollutants don't simply wash away for seniors, they accumulate, and they may be damaging your brain more than you could possibly imagine. Let's carefully examine strawberries and uncover what truly lies beneath that appealing red glow. If you find these insights helpful, please let me know by commenting number 1 below. Now, onto strawberries. Their vivid red, heart-shaped, sweet and tart appearance screams innocence and health. Strawberries appear in hospital meal trays, brain health smoothies, and retirement community brunches nationwide. Yet, the truth about strawberries is far less sweet for older folks. This beloved fruit may subtly increase your risk of stroke, chronic inflammation, and long-term brain poisoning. Let's start with what most people don't realize. Strawberries are among the most heavily sprayed fruits in America. Year after year, they consistently top the Environmental Working Group's Dirty Dozen list of produce with the highest pesticide residues, even after thorough washing. Seniors, whose detoxification systems are often slower, have difficulty eliminating these accumulated toxins. They can build up in tissues, including the delicate brain, leading to neurological damage and weakening blood vessels. Not only are pesticides irritating, but many of them, especially those used on traditionally grown strawberries, are neurotoxic, meaning they directly damage brain cells and increase oxidative stress in aging neurons. This insidious process erodes small blood arteries, particularly in the brain's white matter, making it more susceptible to certain types of strokes, memory loss, and cognitive decline. Increased inflammation and clot formation further heighten the likelihood of ischemic events after such injury. The risk extends beyond insecticides. Strawberries also contain purines, which break down into uric acid in the body. For seniors with gout, kidney illness, or vascular inflammation, high uric acid can trigger inflammatory responses that constrict blood vessels, raise blood pressure, and lead to blood clots. My strawberry-loving patient, Mrs. Elaine Carter, 80, from Michigan, exemplifies this. She passionately gathered fresh strawberries every June, froze them for winter smoothies, and ate a handful after dinner because she believed they were so nutritious. She had mild hypertension, treated with a water pill, and experienced periodic joint pain. Over time, she developed persistent morning dizziness and chronic joint swelling. One morning, she awoke with right hand numbness and slurred speech. Her CT scan revealed a small ischemic stroke. Her lab tests showed high uric acid levels, oxidative stress, and low-grade inflammation, all potentially exacerbated by years of pesticide residue and purine overload from her beloved strawberries. What was intended to protect her health became a quiet, everyday risk. Yes, it produced a clot her body could no longer clear. Elaine survived, but she lives with slight memory loss and hand nerve sensitivity. When she tearfully informed me, I thought I was doing everything correctly. It underscored how critical context is in aging nutrition. Even superfoods can become quietly poisonous in the wrong body, at the wrong time, and in the wrong situations. What should you do? Always choose organic strawberries. Wash them meticulously. Do not consume them daily, and don't rely on them as your primary source of antioxidants. If you have gout, kidney problems, or are on blood pressure medication, consult your doctor before incorporating them significantly into your diet. Be especially cautious with frozen strawberries, particularly in smoothies, as many come from large-scale cultivation elsewhere with less stringent oversight. What you don't know can slowly, quietly injure you until a blood clot tragically steals your words, your balance, or your independence. And if strawberries surprised you, wait until you hear about a fruit that sounds exotic, luxurious, and brimming with health promises, yet may be silently disturbing your blood pressure and instigating morning strokes. Let's explore mango and why this luscious tropical fruit may not belong on your plate. Many older folks view mango as a delightful tropical reward for good behavior, naturally sweet, delicate, and fragrant. It's often sliced into fruit salads, blended into smoothies at senior wellness cafes, or dried and packaged as a healthy snack in grocery stores. The brilliant orange flesh is often marketed as nature's ultimate treat. However, mango may secretly be a quiet saboteur, elevating stroke risk in elders, particularly those with cardiac problems, high blood pressure, or who take multiple medications. The painful truth, mango is a remarkably high-sugar fruit. A single cup of ripe mango can contain up to 45 grams of natural sugar, more than a standard donut. Unlike complex carbohydrates, mango sugar is absorbed incredibly quickly, causing rapid blood sugar spikes, subsequent insulin surges, and inevitable crashes. This glycemic roller coaster can severely strain brain blood vessels, especially in seniors already struggling with insulin resistance, type 2 diabetes, or unstable blood pressure. Inflammation invariably follows blood sugar increases, tightening arteries, and slowing circulation. Chronic inflammation can even produce microscopic breaks in the brain's fragile capillaries. Once this happens, the body attempts to repair these tiny gaps with blood clots. While this is a natural defense mechanism, within a restricted or stiff vessel, it might trigger a devastating stroke. Yet mango's impact extends beyond blood sugar. It also contains natural chemicals that can disrupt how your liver processes various medications, including those for heart rhythm, cholesterol, and blood pressure. Some studies suggest that mangiferin, a compound in mango, slows down the cytochrome P450 enzyme system, which your liver extensively uses to break down many prescription medicines. When this crucial system slows, drugs can accumulate in your body, dramatically increasing the danger of overdose, severe side effects, and dangerous interactions. Medications like amlodipine, metoprolol, and statins, when inhibited by mango, can cause your blood pressure to drop perilously low or your heart rhythm to change unexpectedly. Let me share the story of William Booker, an 83-year-old retired firefighter from Nevada. He prided himself on daily walks, a balanced diet, and exploring heart-healthy foods. A few months ago, he started eating dried mango slices every afternoon, genuinely believing he was making a wise swap for cookies. He also took medicines for high blood pressure and atrial fibrillation. After a few weeks, William began experiencing frequent morning dizziness. One day, getting out of bed, he fainted. His wife found him pale, bewildered, and with a distinct facial droop on his left side. Hospital scans confirmed a mild ischemic stroke. Lab tests showed his blood pressure had dropped too low overnight, and his medication levels were abnormally high despite taking the correct prescribed dose. After reviewing everything, his doctor and I identified the culprit. His daily dried mango had overwhelmed his liver, interfering with his medicine processing. The sugar increases further exacerbated the issue, fostering clot formation. Although William survived, the stroke damaged his coordination and short-term memory. He now lives with daily reminders of how nature, seemingly benign, nearly snatched everything from him. I strongly recommend that elderly individuals reconsider tropical fruits like mango. Their sweetness can hide true peril, not only from the sugar, but also from how they interact with the aging body's slowing metabolism and the complex network of drugs many seniors depend on. Even a few slices, especially dried ones, might gravely upset your body's delicate balance. The safest approach, if you genuinely enjoy mango, is to consume it in tiny amounts, no more than a few bites, and strictly during the day, never before bed. Always add protein or healthy fat to mitigate sugar spikes. If you take prescription drugs, especially for heart conditions, cholesterol, or blood pressure, you absolutely must consult your doctor. At this age, mango may simply not be good for you, because our margin for error reduces with each passing year. What we tolerated effortlessly in our 30s and 40s can today cause major health problems, even from fruit. After reading about these 9 seemingly healthy fruits, you may be left questioning what on earth you can eat to nourish your heart, support your aging brain, and still genuinely enjoy your meals. Do not worry. We will now show you truly brain-safe foods that boost memory, enhance balance, and mercifully don't interact dangerously with common medications. Pills, powders, or exotic ingredients are utterly unnecessary. The solution lies in simple, whole foods and vital knowledge. Let's talk about truly healing meals. One last thought: the profound truth about fruit, aging, and protecting your brain. After reviewing the 9 fruits that may appear healthy or harmless, but quietly escalate stroke risk, you might feel perplexed or even betrayed. You've consistently been told that fruit is nature's medicine, a direct gift from the soil you can trust implicitly. However, for individuals over 60, the truth is far more intricate and absolutely crucial to understand. Everything changes with age. Foods that tasted invigorating and supportive at 30 or 40 are processed differently now. Your kidneys filter at a slower pace. Your liver metabolizes drugs with less efficiency. Your blood vessels become a little more brittle, a little less flexible. Your brain, the most exquisitely fragile organ, grows more susceptible to fluctuations in blood pressure, sugar, and clotting factors. This means every single mouthful matters more than ever before. With the best of intentions, many elderly individuals inadvertently develop brain-damaging habits. A banana with morning medication, grapes for a light snack, pineapple after dinner, or a large glass of orange juice to start the day. We don't suspect these habits because they are so deeply ingrained and widely accepted. However, they can set in motion a silent, unseen, and sluggish series of changes that increase inflammation, harden arteries, thin the blood too much or too little, and in the worst cases, create deadly blood clots that choke off oxygen to the brain. As a brain doctor, I have tragically witnessed the devastating consequences firsthand. People waking up feeling fine, only to end up in the ICU. A clot the size of a grain of rice, in the wrong place at the wrong time, has left countless individuals unable to speak, walk, or even recognize their loved ones. It is truly heartbreaking, and sadly, many of these occurrences could have been prevented with better dietary awareness, tailored to age, not necessarily with more drugs. The good news, however, is that not all fruit is problematic. Some fruits, when chosen and consumed with wisdom and care, can indeed protect your brain, heart, and independence. So, what should you reach for? First, berries. Blueberries, raspberries, and blackberries are low in sugar, packed with potent antioxidants and rich in polyphenols, which actively protect blood vessels and prevent inflammation. They naturally boost cognition and circulation without raising blood sugar or interfering with medications. Second, Granny Smith green apples. These apples offer brain-protecting antioxidants and a significantly lower glycemic impact than their sweeter counterparts. They provide gentle, sustained energy without a sudden crash when eaten with a little cheese or nut butter. Third, many people forget that avocados are fruits. They contain beneficial lipids that help lower blood pressure and strengthen nerves. While they do contain potassium, your body absorbs it slowly and gradually, avoiding the problematic surges associated with sweeter fruits. Fourth, limes and lemons. These are best used as taste enhancers, not standalone snacks. They significantly aid liver detoxification and digestion without introducing excess sugar or interacting with most medications. A simple squeeze into water can safely hydrate and awaken your senses. Fifth, pomegranate sparingly. The juice is quite potent, so if you enjoy it, drink only a few ounces. Its antioxidant capabilities can be beneficial, but be cautious if you're on blood pressure or heart medications, and always discuss with your doctor. Above all, timing counts. Fruit is best consumed early in the day and always with protein or healthy fat to slow absorption and reduce any rapid spikes in sugar or blood pressure. Absolutely avoid eating fruit before bed. As your body winds down, blood circulation naturally drops, and a sudden increase in sugar or acid at that hour can fatally tip the scales, often without your awareness until it's far too late. Please understand, this message is not meant to instill fear. It's about honoring your age, your body, and its subtle cues. Though you are certainly not frail, you have changed, and that's a beautiful, experienced truth. You can absolutely still enjoy life's sweetness, but it now requires wisdom and the profound respect gained from a lifetime of experiences. You have reached this point through perseverance, wisdom, and diligent self-care. Do not let a simple, unconsidered habit or a seemingly innocent fruit steal your hard-won health and independence. Every choice, even a seemingly simple snack, can either boost or slowly diminish your well-being. Read labels critically. Ask your doctors probing questions, and truly consider what's on your plate and how it might affect your health in the weeks and months to come. Because eating to merely survive is no longer enough. Eating intelligently keeps you sharp, keeps you standing tall, and ensures you can live vibrantly with the correct knowledge, chosen fruits, and impeccable timing. Be smart and be aware that your brain absorbs whatever you feed it. Feed it your desired destiny. These lessons are intended to empower you to live fully and authentically. I want to hear from you. Reflect on one item you've learned today and genuinely commit to utilizing it in your life. Let's help each other accept these vital truths. Like this video. Leave a comment below with 1 if this resonated with you. If not, comment 0. We genuinely value your input for continuous improvement. For more videos like this, please like, share, and subscribe to our YouTube channel. Thank you for viewing, and here's to truly living your own beautiful life.